All right, welcome everyone to Fayetteville Mental Health Advisory Board webinar. Today's topic is culturally responsive mental health care. Today we have board members such as myself and Ms. Sophia Githers. My name is Ashley Martin. I am a licensed professional counselor and also a board certified behavior analyst. And we can go to the next slide. Alrighty, so the agenda today is to have access to culturally attuned entry points, engagement when it refers to trust, language, and rapport, discussing safety measures when it comes to trauma-informed inclusive care, and outcomes regarding to equitable measures and improvement. All right, when it comes to culturally responsive care, we've broken it down as far as the definition, as well as the evidence of impact and how it impacts all of us. For us, a definition, recognizing and honoring clients' cultures in mental health care by adapting communications and interventions to be relevant, respectful, and effective. As far as the evidence of impact, making sure it's culturally matched the care that improves engagement, client satisfaction, and adherence to treatment plans. So really individualizing the care. Disparities, trust, outcomes, and ethics. There are 4 bullet points here, and they've all been divided up to kind of explain what they may consist of. We have trust, we have ethics and opportunity, disparities, and outcome. As it relates to trust, it's the historical unethical practices that fuel mistrust and disengagement from healthcare systems. As it relates to ethics and opportunity, ethical imperatives demand culturally responsive care to close gaps and promote equity. Disparity, minority groups face access barriers, lower quality care, and poorer mental health outcomes. And lastly, when it comes to outcomes, culturally unresponsive care reduces treatment efficiency and safety for diverse populations. In a nutshell, when it comes to disparities, these are things that definitely weaken the healthcare um, industry. Some core principles, we have cultural humility, client culture, strengths-based, and shared decisions. When it comes to cultural humility, clinicians engage in ongoing self-reflection to recognize and address their own biases and fostering respectful and open-minded care. I think this is really important when it comes to us as healthcare professionals and those that service others, especially because we have to know ourselves so that when we represent our services, we come unbiased and open-minded to those that we service. When it comes to client culture, care is prioritizes the client's cultural identity, their values, their traditions that ensures interventions that are relevant and respectful. We all believe that this is definitely important at the onset of offering any services so that you know what that client values or what their traditions are so that we don't offend anyone. When it comes to strengths-based, being able to focus on identifying and leveraging client strengths to build resilience and empower positive change. So definitely finding ways to build that confidence. In shared decisions, clients are actively involved in their care decisions that is aligning with their own treatment and their cultural preferences and reducing power and imbalances. I think a rule of thumb for this would make sure that your approach is is a person-centered, allowing that person to be that driver of their own vehicle, and you're just the passenger there to assist them through their journey. All right, here we have four different cultural formulation steps that's also been broken down. One being the cultural identity in the background, the language, ethnicity, mitigation, and the religion and social roles. Two, the illness, understanding and context, explanatory models and stressors, and supports and meaning of symptoms. So that way you understand the context and what exactly is happening. Three, the stressors, supports, and resources. Comes with discrimination, access barriers, family dynamics, community, and coping strengths. And number four, the clinician patient relationship, the communication style, the trust, any biases, and alignment of treatment. This is definitely important to be able to foster competent care for any individual that's in service. Next, we will be talking about trust building communication. This is also another important factor when it comes to identifying any outsource of help that you may feel that you may need um, when it comes to your care. Making sure there's active listening, meaning that there's a use of open posture, reflective summaries, someone's conversing back and forth with you to make sure that you're understood and they're understood. And there's also pauses to show that attention is given. Excuse me. Respectful inquiry. You want to ask cultural beliefs and curiosity and consent with no assumptions. Transparent explanations. These are clearly explained diagnosis, options, and limits, and it also invites questions. This is definitely important too, because a person that is seeking care should know their diagnosis. They should know what limits and options, and if there are questions that they have, they should be able to get those answered. And if that individual may not be able to answer them, then they should be able to get a response back in a timely fashion. And lastly, we have empathy and validation. When you acknowledge discrimination as stigma experiences and affirm dignity. Once again, you're here to build that confidence and self-esteem level for that individual to be able to thrive. 67% of patients report bias and microaggressions, lowering satisfaction and trust. This definitely is it's a problem at an alarming rate. And these type of discussions are necessary because as professionals in the field, when it comes to care, competent care, we want to assure everyone that we hear you. And these are resources to help you know the limitations and resources that you may want to look into to make sure you're getting competent care. Next, we have diagnostic assessment pitfalls. We have the clinicians may over pathologize culturally sanctioned behaviors or miss culture bound syndromes. We have symptom meanings can be misinterpreted across the cultures, leading to misdiagnosis and underdiagnosis. We have cultural competence in assessment improves accuracy and context sensitivity. And the use of detailed text is illustrated pitfalls with brief clinical examples. When it comes to diagnostic assessments, there are pitfalls. And a lot of these pitfalls come from approach of having unbiased and not being sensitive and aware of the individuals that's being assessed or interviewed, meaning that if you have an individual that needs certain services, there should be preliminaries in place to ensure that their comprehension, their understanding is there, so that way they're able to properly give the feedback that's needed. Culturally adaptive care. We have language and metaphors. They modify terminology and explains to reflect clients' cultural references while preserving therapeutic intent. We have evidence-based foundations that maintain fertility to core principles and mechanisms of change and ensuring adaptations do not dilute effectiveness. And lastly, we have cultural practices that integrate rituals and values meaningful to the community, ensuring they support evidence-based goals. All right, we now are going to discuss some symptoms of level equity strategies as far as what can institutions definitely put in place, providers can definitely put in place to ensure competent and responsive care is upheld. We have policy reform, we have expanding coverage, disseminal structural barriers to timely and affordable care access. We have workforce diversification. We recruit and retain teams reflecting communities served to foster concordance. We have training mandates. There should be required cultural responsiveness and equity training for all staff and ongoing, a sense of community partnership, co-design solutions with local organizations to build that trust and relevance. There should be data monitoring to be able to see what's working, maybe what's not working, tracking and analyzing reports disparities to drive accountability and a sense of action that may be warranted. We want to be able to sustain environments. And lastly, build cultures and systems that enable ongoing, equitable, and responsive care. Some immediate clinical actions. Here we have a listing of at least six. One deals with self-education. So even as myself, learning about cultures in your practice to understand needs. Two, bias training by being a participant in training to recognize and address biases. Three, we have cultural formulation by applying cultural formulations to tailor assessments and care. Four, we have communication techniques to enhance skills to bridge the cultural gaps and build trust. Five, being able to seek supervision on cultural issues for guidance and support. And I definitely feel like this is really important because as a provider, if there is a situation where you question your own capability, instead of accepting a client or a certain population, you have to do your due diligence to make sure that you're competent and outsource and maybe getting a mentor or supervising your own self so that you make sure that you are given that culturally responsive care. And number six, language services advocacy. You advocate and use language services for accessibility. All right, 92% of client satisfaction after culturally adaptive CBT actions include cultural interviews, retention, tracking, bias checks, and feedback loops. So by client satisfaction after adapting CBT, or I'm assuming cognitive behavior therapy, being able to include cultural interviews, retention rates, bias checks, and feedback loops. Advancing mental health equity, access and engagement that leads you to culturally responsive care that improves entry, rapport, and sustained participation, that leads you to humility and bias, then leading to practice cultural humility, examine bias, and ensure safety and respect, that adapts treatment, that leads to tailoring assessments and interventions to each person's cultural context, which leads you to a more of a systematic or system strategies. And lastly, being able to implement tangible actions that build trust and advance equity. Alrighty, so some key takeaways here today that we would love for you to be able to take away from this is that culturally responsive mental health care is clinical excellence. Culture definitely shapes how distress is experienced, expressed, and treated. Cultural humility, not cultural expertise, is the foundation of effective care. Strong therapeutic alliance is the primary pathway to better outcomes. Bias awareness and repair strengthening trust can reduce dropout. System change, not just clinician skill, is required to reduce disparities. And lastly, small and consistent practice changes create measurable impact over time. There's no one way to start, but the goal is to start. And the goal is to become competent, and the goal is to become culturally aware that everyone is unique and different when it comes to their experiences and their backgrounds, being able to create a foundation that is filled with support, evidence-based practices, and competent clinical skill sets that will help that individual and or population to become more independent and resilient for themselves. All right, we will always want to leave you with some community resources. We have the Fed Mental Health Advisory Board, which can be reached at fedmentalhealth.org. We have the Fed Care Clinic that can be reached at 770-719-4620. You may want to visit findhelp.org. That's findhelp.org. You may want to call or get in contact with the Georgia Crisis Access Line. It was 1-800-715-4225. We also have NAMI, which is the Georgia helpline for the National Alliance of Mental Illness, is 1-800-950-6264. And then lastly, for any suicide or crisis lifeline that offers 24/7 support when it comes to mental health, you can call or text 988. Thank you again from the Fayetteville Mental Health Advisory Board. Our contact is Councilwoman Dr. Glover, may be reached at nglover@fayetteville-georgia.gov, and a direct link to the resources is the Fayetteville, Georgia-mentalhealthhub.org/. Thank you all for joining.